Good day, panel and hosts over there. This is the third International Scientific Electronic Conference of the Texila American University. I'm presenting a case on societal variables and prevalence of substance abuse among youths in Calabar, Cross River State, Nigeria. This case is presented by Umoh Edet Okon, a student of PhD nursing, majoring in psychiatry. Introduction. Reckless use of substance and alcohol is a public health issue posing over 4% of global disease burden. It is an excessive intake of psychoactive substance, illicit drugs and alcohol like beer, tobacco, Indian hemp, cannabis, cocaine, pot, and marijuana. Substance abuse substance are drugs consumed to obtain high feelings with false sense of self-satisfaction, which continual usage produces dependence syndrome leading to clusters of behavior, cognitive and physiological phenomena. Over 120 million people use substance, and it is reported that 51,000 deaths result from opioid users, 4,300 deaths from cocaine users, 3,800 deaths from amphetamine, and 189 deaths from alcohol users. Statement of problem. Drug abuse hinders individuals' progress, breaks down subjects, shatters family, and weakens the entire society's community with its burden of socio-economic loss, increased health costs, lawlessness, and crime. Many teenagers in Calabar South take stimulants, which pushes them to antisocial practices like violence, rape, stealing, and kidnapping. In Federal Psychiatric Hospital Calabar, over 80% of male admission, either as a fresh case or in a relapse state, is related to substance abuse. The researcher observes that societal variables like tradition of Calabar, availability of substance, families to peer influence on abusers, and activities of the government security agents enhance consumption of substance as youth consume substance without check and control. Associated scientific theories. Theory of unitary human beings by Rogers, 1914, is adopted in this theory, believing that there is a coexistence between humans and the environment. In this regard, patients use substance from environment to stimulate and cloud their deficiencies and in achievements. Helen Erickson's theory of modeling and role modeling, 1936, is also applicable in this study when patient's mental state is overtaken by intoxicants and patients need to model and patient needs a model to imitate. The nurse responds to patient as a unique being, facilitate and nurture patient to assume a promoting health status. Now, material, method, and tools. The ex post facto research design was used for this study. The design is considered suitable for the study because the variables under investigation are assumed to have occurred and cannot be experimentally manipulated in the process of study. This research design utilizes instruments like questionnaire, face validation, and interview for the collection of data. From the population of 22,000 youths from Calabar Municipality and Calabar South, 1,000 youths were randomly picked as sample as they were met at various drinking to smoking joints within the area. Cronbach's alpha reliability analysis was used to test the reliability, while simple percentage and Pearson product moment correlation analysis was used to test the hypothesis. Results and discussion. The study was carried out to examine societal variables and prevalence of substance abuse in Calabar, Cross River State. In order to achieve this purpose, 4 objectives, 4 research questions, and 4 hypotheses were formulated to guide the study. Hypothesis testing. Results of hypothesis 1 shows that the calculated R value of 0.72 is greater than the critical R value of 0.052 at 0.05 level of significance with 998 degrees of freedom. This implies that there is a significant relationship between tradition and prevalence of substance abuse. Results of hypothesis 2 shows that the calculated R value of 0.69 is greater than the critical R value of 0.052 at 0.05 level of significance with 998 degrees of freedom. This implies that there is a significant relationship between availability of substance agents and prevalence of substance abuse among youth in Calabar. Hypothesis testing continue. The result of hypothesis 3 shows that the calculated R value of 0.64 is greater than the critical R value of 0.052 at 0.05 level of significance with 998 degrees of freedom. This implies that there is a significant relationship between peer group and prevalence of substance abuse. The result of hypothesis 4 shows that the calculated R value of 0.78 is greater than the critical R value of 0.052 at 0.05 level of significance with 998 degrees of freedom. This implies that there is a significant relationship between government agencies and prevalence of substance abuse. Recommendation. Number 1, government should arrest and punish substance traffickers and abusers to serve as a deterrent to others, which in turn will help to reduce the incidence of substance abuse. Number 2, government officials should not indulge as well as encourage substance abuse. Number 3, government should mount a serious check at the highway to nab all vehicles coming into Calabar with substance, regardless of the official as a driver or as an escort. Number 4, community leaders, family elders, and church ministers should live an exemplary lifestyle, preach and discourage youth from destroying their future through substance consumption. Number 5, the public should report and expose traffickers and consumers to government security agents for necessary action. These are the references applicable to this study. Haladu AA 2003 outreach strategies for curbing drug abuse was relevant in this study. Hong CC 2009 Association of Parents, Alcohol Use and Family Interactions was also relevant in this study. I also brought in Sandok BJ 2007 Synopsis of Psychiatry, the 10th edition, page 41, was very relevant in this study. Also applicable was Townsend MC 2011 Psychiatry Mental Health Nursing, the 8th edition. Online study, I used easyrate.abuse.government/content/drug people abuse. Conclusion. Based on the finding of the study, it is recommended that there is significant relationship between tradition and prevalence of substance abuse among youth in Calabar. There is significant relationship between availability of substance and prevalence of substance abuse among youth in Calabar. There is significant relationship between peer group and prevalence of substance abuse among youth in Calabar. There is significant relationship between government agencies and prevalence of substance abuse among youth in Calabar. It is concluded that societal variable contributes to prevalence of substance abuse among youth in Calabar, Cross River State, Nigeria. Suggestion for further study. On the basis of the findings of this study, the following suggestions were made for further studies. A similar study should be carried out on effect of religious activities on substance abuse among youths. A study of this nature should be carried out on the influence of societal variables on deviant behaviors among youth in higher institutions. A similar study should also be carried out by future researchers on the role of unemployment on substance use among inhabitants of Cross River State. Thanks for listening.